Hello dear friends. So this is a patient of a difficult frontal sinus where there is a thick nasofrontal beak. Also anterior femoral artery was dissect in this patient. So we decided to take this patient for drill out procedure. So in patient where there is a thick nasofrontal beak and we are expecting a difficult access to the frontal sinus. So this is a very good approach. So first we make a flap anterior to the middle turbinate area, and then we try to drill out that area with a 70-degree burr and a 0-degree scope. So this is a 70-degree burr and we are using a 0-degree nasal endoscope. So first we start drilling from the lateral side. So the first structure to be drilled is lamina papyracea. So along the lamina papyracea you start moving from lateral to the anterior side. So slowly as we come to the anterior side, we can see the thick nasofrontal beak. On a sagittal sections of a CT scan, so this was pretty anticipated that there is going to be a thick nasofrontal beak. So now after some drilling, so we can see that we can see the osseum of frontal sinus. But since the nasofrontal beak was obscuring the view and it was very thick, so again little bit more drilling is needed. So all the time care has to be taken. The whatever bone we are drilling and whatever bone after drilling is left should not be uncovered with the mucosa. So whatever bone is left should always be covered with the mucosa. So try to drill in such a manner and try to make a flap in such a manner that you should not leave any raw bone. So after a lateral drilling and then anterior drilling and anterior posterior drilling, you see that frontal sinus is coming into the view. So still this we are using a 0-degree nasal endoscope and 70-degree burr. So slowly, so we are making a more access. So if we have middle turbinate in a view, that makes a middle limit, and laterally we can drill that bone comfortably. So we are away from the skull base, and to protect the posterior skull base, always keep a marrow seal on the posterior skull base so that we should not, or accidental entry or burr should not be hitting the posterior skull. So we have substantially drilled out the bone, and our osseum is pretty okay, and so we are seeing the osseum nicely. So the whole aim is that the end point is that at least 4 to 5 mm of the instrument should enter. So now we shifting to a 70-degree endoscope to inspect inside the frontal sinus, and now you see deep inside the frontal sinus there is some sort of purulent secretions are there. So gentle irrigation with the curved section, and then we again inspect with the 70-degree endoscope. So now it seems pretty clear. So this is the reversible mucosa which we are sure are going to reverse with medication. And then at the end you see there is a descent anterior femoral artery. And in cases where anatomy is difficult and artery is descent, so this approach is very nice and it should be followed for easy frontal sinus entry. Thank you so much.